We are dealing with an epidemic of mistrust.
Dr. Marty Makary says during COVID-19, public health leaders lost credibility, touting experimental policies like long-term school closures and banning visitors from dying hospital patients.
That was a human rights violation. Nobody should be prevented, regardless of the circumstance, from holding the hand of their dying loved one in the hospital. But the medical establishment has not apologized.
In his book, Blind Spots, Makary warns that public health officials made other mistakes over the years. For example, advising parents not to let their children eat peanuts.
It turns out that peanut avoidance in the first few years of life doesn't prevent peanut allergies, it causes them. And so ignited the modern day peanut allergy epidemic.
Another poor decision, according to Makary, is the misguided approach to pain pills.
The opioid epidemic was caused by the medical establishment putting out a dogma that opioids were not addictive.
And he's critical of longtime financial influence affecting how medical experts advise Americans on their diet.
The obesity and diabetes epidemic may have in part been caused by the dogma of the food pyramid that was financed by the food industry.
These types of errors, according to Dr. Makary, often stem from a wrong way of thinking that not just doctors, but all of us can fall into.
We tend to believe what we hear first, not because it's more logical than new information, but simply because we heard it first. And that sort of intellectual laziness means that our brains will subconsciously reject new information or reframe it to fit what we already believe.
Makary cites that as the reason why 80% of doctors today deny older women highly beneficial hormone replacement therapy.
There was a medical dogma propagated 22 years ago by the National Institutes of Health, where a doctor claimed it caused breast cancer when the data never supported it.
And why too many doctors continue to overprescribe antibiotics, even as new data show these drugs kill important gut bacteria.
They train the immune system. They even produce serotonin, which is involved in brain health and mood. And so this microbiome is central to health. It's been in a blind spot of modern medicine. We don't talk about it much.
Another blind spot, doctors believing they create a suicide risk by not helping young people change their gender.
The worst thing you can do in science is to tell a parent or a patient something with such absolutism, saying that it's scientifically supported when it's not. And it turns out that the increased suicide risk is driven not by the gender dysmorphia diagnosis that's assigned to the kid, but rather the underlying mental health disturbances.
Makary adds that health professionals and the public need to question and research certain long-held beliefs that could be based on wrong information.
We need to recognize that our brains have that human tendency and then temporarily and actively suspend our biases, because we all have biases, we have to acknowledge that, and suspend those biases as we consider new information objectively.
And while pointing out the need for change, Makary warns against overreaction.
We don't want to create hysteria in the general public about the medical profession. If you're in an emergent or urgent situation, do whatever the doctor tells you. But when it comes to chronic abdominal pain, or what's actually causing our epidemic of autism or autoimmune diseases, or the general inflammatory conditions that are now epidemic in society, we don't have a good answer for you.
Makary sees modern diet and lifestyle as the most likely culprits and points people back to a more spiritual approach.
It's almost as if we're now rediscovering that many of the biblical principles around health is where we need to get back to. It's not a matter of discovering things. It's a matter of reminding us of our great heritage of good health.
And that includes eating whole foods the way God created them instead of processed. Research also shows practices like prayer, fasting, and being part of a community can result in a number of physical benefits. So while public health guidance can be confusing and even wrong at times, evaluating recommendations with an open mind and through a spiritual lens can help. Lorie Johnson, CBN News.